great day to you. Hope you're doing well out there. And just want to finish up a conversation we had last week about misconceptions of chiropractic care. We covered a few last week, and this week we'll cover a few more. And so if you have any questions about what we covered last week, just go to last week's video. Is on our website, on our social media outlets. So please go there, look at those. And if you ever have any questions, feel free to reach out. And the best way to reach out is either over the phone, email, or even face to face. I'm not real big on social media, even though I post on social media. I put things out there for you to consume, but if you reach out to me there, I may or may not get it. So just to be sure, a phone call, an email, be probably the best way, and I know that's probably inconvenient for some of you. Sorry, but I just don't respond or go back to post very often after whatever social media outlet that is on. So, but misconceptions of chiropractic, part 2, so I want to call this, and just to clarify some things, just so that you know, and you have an idea of, hey, maybe that wasn't right, because we've all had thoughts about things that we just weren't sure about, and I get it. It's very easily and commonly done, so, but anyway, the first misconception we're talking about today is how there's talk out there how chiropractic care is not scientific, and that's almost laughable, because even the very first chiropractors had their roots in some research, even like in the early 1900s. And what's so funny about that is even the medical profession, even back then, were doing research to disprove chiropractic. And the more they tried to disprove chiropractic, the more it was proven. And so it's just funny how that happens. When you try to disprove something, you can prove it more, and that kind of got swept on the rug, back in the 20s, of 1900s, not in the 20s of 2000. So, but anyway, research is done by most chiropractic colleges. I know Life University and Sherman College do tons of chiropractic research and just like all kind of things. Anything from helping kids to helping geriatrics with different things. So, and it's out there. And it's something that I use in my office. So I have a chart here that I use. I think I even showed in my videos before about how we de-evolve and how the head goes forward and puts pressure on the muscles and then the disc and eventually puts pressure on the nerves. And eventually, here's the kicker, medical research shows that it stretches the spinal cord, causing health issues. And that's from research done by Alf Brigg. He's a neurosurgeon. So, it's not necessarily chiropractic research, even though chiropractic does a ton of research. Even the medical research backs it up too. So just putting that out there so you have that. So if you ever hear that, oh, it's not scientific, it's kind of laughable, but just want to let you know that, hey, there is a lot of research out there for chiropractic. Some of it's not even done by chiropractors, but it's out there, okay? And so the next misconception is adjustments just crack bones. And I'm like, you may hear a noise, but here's the kicker. With an adjustment, you may not hear any noise at all. You may just not feel anything, really, when the adjustment happens. But here's the key. Here is the purpose of the adjustment. It's not necessarily to move the bone where you hear it make these noises, and all the noise is gas releasing from the joint space. More specifically, nitrogen gas. It builds up in the joint, and when you move the joint, any joint, your knuckles and your fingers, or your neck, your spine, when you release that joint gas releases, specifically nitrogen gas. And then when you give an adjustment, it's not necessarily hear the noise, even though it may make a noise. The adjustment is to reduce nerve pressure, to reduce nerve interference. That's the purpose of the adjustment. Because once pressure off the nerve, then the body can heal and adapt accordingly to whatever it may need to adapt to. So that's just one of those things. And then I don't know where this comes from. This is a misconception that some people may have or have heard, and I've heard it a few times. And I'll say it, then I'll give you my interpretation of it. Is chiropractic can cure everything. I don't know if a chiropractor said that or if it's something somebody had mentioned, but I remember in school that was brought up, and the older chiropractor that was presenting it to us said, you know what? Only thing that gets cured is meat. Chiropractors don't cure anything, or nobody cures anything. And what I was referencing to is, when you have some meat that you're ready to prepare, you have to let it cure first. And so that's what gets cured. Chiropractic doesn't cure anything. And I even tell my patients, as your chiropractor, I don't treat anything. But I treat one thing. That's what I say. I treat one thing. I don't treat your symptoms. I treat the subluxation, the pressure on the nerve. And then when you take the pressure off the nerve, amazing things happen. The body can heal and adapt to whatever it needs to. As I said before, the body is a self-healing organism. And once there's no pressure on the nerve, it can heal and adapt. So if you're looking to be cured, then you might want to go to a butcher. If you're looking to heal, hey, chiropractic care's right up your alley. It's maybe what you're looking for. So, and that's just something to think about. And the last thing that I want to talk about today is, and the misconception, we'll kind of wrap this series up with this, is no pain, no need for chiropractic care. And I use this analogy a lot in my office, and I think it makes sense. If it doesn't, hey, let me know. And this is what I tell my patients. Do you only brush your teeth when your teeth hurt? If that's only when you brush your teeth, you probably don't have very good teeth or very many teeth. You have to take good care of your teeth. And I teach people, hey, that's why we take good care of your spine. Sure, there may be injuries there already. It's like your teeth may have cavities already. That doesn't say, oh, I don't need to do anything about it. I already got cavities. No, you want to stop more cavities. And the same way with your spine. If you have an injury already, and it sure happens, life happens. There's limitations to everything, right? That doesn't mean you don't need to take good care of it. It just means that you have an injury already. And you still need to take care of the ones that are healthy now. Because if you don't, as we all know, what's healthy now, if not taken care of, will be unhealthy later. It's just proven fact. We have to take good care of ourselves. It's our responsibility to take good care of ourselves. And a good chiropractor can help you with your spine, which is going to help you with your life. So, and here's what just to follow up on that even more, is no pain, no need for chiropractic care. Pain is typically the last symptom to show up and the first one to go away. And that's with anything. Whether you break your leg or sprain your ankle. Hey, as soon as it happens, you may not feel much pain at all. But the split moment that, you realize it, the pain really sets in. So it's the last thing to show up. But in those microseconds, milliseconds before the pain sets in, hey, guess what's happening? Blood's flowing there, inflammation's building up. The cascade is going to heal the best that it can. But the pain is the last thing to show up. And even when there's no pain, say weeks later, there's still healing happening. There's still the process of building new bone with the broken bone or with the ligament is still getting healthier as well. So just know that pain for anything is not a reason to get care. Pain is one of those things. It's the last warning sign your body's trying to tell you, hey, something's wrong, something's wrong, something's wrong. Even when we quit listening, when we don't listen to it or we numb it up, it gets louder and louder and louder. So just know that the pain is one of those things that's going to come and go the rest of your life. Whether you go to the chiropractor or whether you just do nothing, you're still going to have pain. But just know pain is a symptom, a warning sign saying something's not right. So I think that hopefully that makes good sense to you. I'm sure it does make good sense to you once you just think about your teeth or even exercise. I use this analogy a lot too, is if you go exercise, sometimes you get a little sore. It's not necessarily a bad thing, but if you exercise too much and you tear something, you get real sore. And that's not what we're looking for. We're looking for the Goldilocks zone, the just right. So just know that pain comes and goes the rest of your life, no matter what you do. So if you're looking for pain relief or just no pain at all, then that's not life. You know what I'm saying? Life has got peaks and valleys and ups and downs, and so we have to roll with those. But if you want a properly functioning body that can adapt to most environments the best that it can, hey, chiropractic care. That's what chiropractic care is all about. It's not just about pain relief. It's about making sure your brain and your body are functioning and connected the best that they can be. I'm Dr. Brenton Jones, West Point Family Chiropractic, and if you're having some issues and you're like, man, I don't know what to do about this. I've been doing this and I'm tired of doing that, or I don't know what to do. I've been dealing with it for so long. Hey, go to our website, westpointfamilychiropractic.com. And the space provided next to my picture where it says learn how, put your email address in there. I'm then going to send you some information on how to help you overcome your injury, get your life back without drugs and without surgery. So fast you go do that. If you know somebody who's been going on the road of ill health and look to their health about, hey, share this with them. They may need to see this too. So feel free to share. Sharing is caring, you know. So, or if you just want to come by and see us, our address is 1106 3rd Avenue, West Point, Georgia. We'll be glad to invite you in and see you and talk with you and, hey, give you a hug too, probably. So, and also if you want to call us, 706-645-1033. Those are the best ways to contact us. The website, westpointfamilychiropractic.com. Come by and see us, 1106 3rd Avenue. Give us a call, 706-645-1033. I'm Dr. Brenton Jones, West Point Family Chiropractic, and I will see you real soon.